Welcome to Secrets of Nursing Homes, giving you a sneak peek of the hidden underbelly of nursing homes. Nursing assessment is of top priority during an admission. It is during this evaluation, patients will be thoroughly assessed and a baseline established for the rest of their time in the facility. This evaluation will be referenced in the future admissions and also other facilities. After the initial assessment, they will be assessed on a daily basis in the areas which are of concern to them. Here's a little vignette that I wrote to illustrate what an improper assessment is. A new shift begins, and Alice is a nurse whom we will follow. Alice has 10 additional patients above the amount federal guidelines mandate. However, whenever she brought it up to the management, they chose to ignore her concerns or told her to stop whining. They told her nurses were a dime a dozen, she could go elsewhere. Alice, a single mom, has 2 children to support, so there is no leaving, just working harder and smarter. Right off the bat, there was a blood sugar reported to be low and 2 hospice patients needing care and medication every 30 minutes. Alice's nursing assistants were also short-staffed and began complaining about having to look after these 2 people. Alice, who became tired of the complaining, did most of the nursing assistants' job so that the patients were comfortable and so that the nursing assistants would shut their mouths and stop complaining. MedPass and computer charting took way too much of her time, so Alice, as usual, skipped her lunch and kept plugging along. The hospital called and were bringing 2 patients in the next hour who would need all the extensive admission documentation completed as well as a full assessment, just in time for the second round of medication. The paperwork, the assessment, and room preparation are things that can take hours for each patient. The nursing home has a rule: if you started an admit, you were to see it through to the bitter end. Even if the admission came 5 minutes before quitting time, you had to stay and finish it, without, of course, recording overtime doing it. The first patient needed labs, an IV, and a hospice consult. She had wounds to be addressed and medications to be ordered. All the charting and assessment of the first admit was well underway when the second admit came. In the meantime, the homeless man in 503 was ringing for the 3rd time for another dose of narcotics and was threatening to throw himself on the floor if he didn't get his way. Now, Alice had cared for this man for over a week now, and he was hiding pills in his mouth and then spitting them out and selling them on the street. And it's a common practice. His pulse was normal. He could walk around without pain, and if no one was looking, he would laugh and play pranks on people. He was not in pain, but he knew precisely the order the doctor gave concerning how much and how often he could get the meds. He also knew if his meds were as little as 5 minutes late, he could get the state to cause problems for Alice. He threatened to turn her in if she didn't drop everything and give him his blank painkillers, as he claimed he was in 10 out of 10 pain. Once she dealt with him and 8 other patients who wanted PRN or as-needed medication, and then 6 blood sugar patients, Alice turned her attention to the second admission. She had already placed him into a room, took his vital signs, and began the task of doing a complete skin check. She had just looked at one of his feet when she heard a loud crash in the hallway. Emma, a patient, had fallen out of her wheelchair, hitting her head. Now there were calls to be made to the family, the doctor, and the facility's director of nursing. Plus, she had to create an incident report, document nursing notes, and conduct neurological checks on Emma every 15 minutes. In between the frequently required neurological checks that would last the rest of Alice's shift, she was now deep into another medication pass. It was hours until she could return to finish her skin check. Let's see, where did I leave off? Alice remembered checking the new patient's feet, and there was nothing out of the ordinary, so she continued on from there. What Alice forgot in all the going on is that she had only checked one of the patient's feet, not the other one. And as it happened, the new patient's other foot was swollen with open areas between his toes. Finally, 2 hours late, and having been forced to work those hours off the clock, Alice went home to pick up her children from daycare. Fast forward 2 weeks, and the patient now had severe infection in her unchecked foot. Technically, the nursing assistants who bathed and dressed him should have noticed that and reported that to the nurses, but they didn't. An angry management team now confronts Alice because her patient has a serious foot infection not reported on the admission form. Who is to blame? The truth is everyone. Look first at Alice. She should have insisted her aides do their work. However, she may not have had leadership training or anyone to have her back as far as management goes. Her heart was in it to protect the patients no matter what. What about the aides? They are responsible as they refuse to do their work, causing more work to go onto the back of an already overworked Alice. Management is responsible as they have already knew that Alice was overworked and they were illegally giving her more than she could handle. You might say Alice should refuse to work when the odds are so against her, but would you? Could you walk away from your job? The sad thing, with so many people bearing responsibility for the problem, it will only be Alice who is held responsible for this oversight. She is the only one who will bear the brunt. Will she be fired? Will she be sued? Will she serve jail time? I've seen nurses suffer all 3 of these outcomes. It is no wonder people are fleeing from nursing. So as a family, you need to check and double check staffing. But I warn you, even though good nursing homes do exist, they are getting harder and harder to find. So that's the end of my story. Next time we'll go on to how to do a proper nursing assessment and what it involves, so you know what to expect. Thank you for watching. If you like us, please subscribe and pass it on. Consider becoming a patron to help us pass this information on to people who really need this. Thank you so much.